As you know, COVID-19 vaccines from both Pfizer and Moderna are now being distributed across the nation. Pfizer's vaccine arriving in central Indiana last week. Moderna's just got here in our area yesterday. The vaccines are currently being given to frontline healthcare workers, and starting next week, they'll also go to long-term care facilities. Many of you have a lot of questions about the vaccines and stuff surrounding it, so joining us now live to answer some of those questions is Dr. Christopher Doering, Vice President of Medical Affairs for Franciscan Health. Doctor, good morning to you.
Hey, good morning. Happy Christmas Eve.
Exactly, and to you as well. The first question, a lot of people say, okay, we got one, we got another. What is the difference, if there is something significant, between the Pfizer vaccine and the Moderna vaccine, and should you choose either one?
Yeah, the two big differences are the Moderna vaccine doesn't require the ultra cold storage, so it's going to be a lot easier to sort of take it out into the community, into different settings. The Pfizer has to be kept super cold, and therefore we're using hospital bases, home bases to dispense that vaccine for now. And then the other big difference is the amount of time between doses. For Pfizer, it's 21 days. For Moderna, it's 28 days. So those are kind of the two key differences, and really no difference in terms of efficacy. They both seem to be about 95% effective. So there's really no difference in terms of which one a certain individual would get. It's just the important part is the same one you got first is the one you want to get second.
Don't mix them. One-dose vaccines, they are in the works, Doctor. What's the difference between those and the current two-dose vaccines? And I know there is some concern that people may just get one shot of the two-dose vaccine and quit. And if that's the case, this might be for them.
Yeah, I mean, certainly the fewer doses, the simpler it is to administer and to accomplish, that immunity. What we don't yet know is, what are the numbers going to tell us out of these other vaccines that are still in development? So until we can see some of that data, we won't really know. Are they comparable to each other? Is one going to be preferable to the other? Certainly, there's no doubt that a single shot vaccine is easier to administer and easier to accomplish, widespread coverage. But again, too many unanswered questions yet because we're too early in the process with the single shot vaccine.
Let's talk about the processes regarding antibody testing. If you know you still have antibodies, can you wait and let others maybe get a vaccine first because you might have some immunity of your own?
Yeah, that's another really good question. And what we are recommending, because the supply right now is still building, we don't have enough on day one to give everybody who needs one vaccine. And if someone's had COVID in the last 90 days, we presume they still have good immunity, and we're asking them to sort of step back in the line, let others go first who've not had COVID. So yeah, we do believe and support that notion that if you have immunity, sit it out to let others go. Perfectly safe to get the vaccine if you've had COVID. That's not the issue. It's really just one of supply and access right now.
When it does come time for everybody to possibly get it, how do they go about it? Go to their primary healthcare worker, and in the meantime, what message do you have to people?
Yeah, those are also unanswered questions at this point. We don't know exactly what the process will be. Some of the vaccines will be easier to handle and to distribute, so I suspect they will be out in the doctor's offices. They'll be out in the pharmacies, CVS, Walgreens. There's a lot of people who aren't sure. These vaccines haven't been around. They've been studied on a lot of people, but not for long periods of time. What I've witnessed over the last week, our first week of having this, is our physicians, our nurses, our other frontline caregivers are absolutely ecstatic about the opportunity to get the vaccine, feel like this is the real turning point in this battle. And so for those who may be reluctant or hesitant to get the vaccine for one reason or another, just look and see how enthusiastic and optimistic our healthcare workers are, our physicians, our nurses, and really take that to heart, follow that lead. And if we can achieve widespread vaccination, we will deal a death blow to this virus.
Makes sense. Good advice. We appreciate it. Dr. Christopher Doering, Vice President of Medical Affairs for Franciscan Health. Doctor, thanks for being here and providing us all the information. We do appreciate it.
Absolutely. Good to be with you. Merry Christmas and Happy New Year, everybody. 2021. Let's go.